Welcome to Lance, lectures about nursing concepts and examinations. And I'm Lance, your lecturer on this nursing channel. In this video, we will talk about lithium carbonate, one of the oldest medications used in mental health, and also a common topic in nursing examinations. We will break down this topic into clear and simple nursing concepts that you can understand and apply in nursing exams and clinical practice, helping you master nursing with clarity and confidence like a true nursing ninja. We will talk about its classification, what it does, how it works, blood lithium levels, its therapeutic effects, what side effects are expected, how to recognize toxicity early, and exactly what nurses need to monitor and teach to keep patients safe. Let's get started. First, what is the drug classification of lithium carbonate? Is it an antipsychotic, an antidepressant, an anxiolytic, or a mood stabilizer? Well, obviously, it is a mood stabilizer. So lithium carbonate is a mood stabilizer. And as a mood stabilizer, what disorders is lithium prescribed for? Lithium is the gold standard treatment for bipolar disorder. It is especially effective in treating acute manic episodes and in preventing future episodes of both mania and depression. Many patients take lithium long-term as maintenance therapy to keep their mood stable. Lithium may also be used as an augmentation agent in people with severe or treatment-resistant depression, particularly when there is a high risk of suicide. In these cases, lithium is added to antidepressant therapy rather than used alone. You also have to remember that lithium is not a fast-acting medication. It does not provide immediate relief from anxiety or agitation. Therefore, it cannot be used as a PRN medication for immediate symptom relief. As a mood stabilizer, its strength lies in long-term mood stabilization and relapse prevention. Now, when should we expect the onset of lithium's therapeutic effect? The initial effects of lithium carbonate will be expected in around 5 to 7 days, while the full therapeutic effects of lithium should be expected after 2 to 3 weeks of continuously taking it. So it is important to explain this to our patients. Explain to them that they won't feel better right away, but it is important to continue taking it. It takes around 5 to 7 days before you can experience the therapeutic effects of lithium. This may include better sleep and less agitation. So how does lithium work? Lithium changes internal cellular processes. Its effects develop gradually. In mania, brain cells tend to fire too easily and too intensely. Emotional responses become exaggerated and poorly regulated. By acting on the inside of the cell, lithium reduces excessive excitability. They make nerve cells respond more slowly and predictably. And they also prevent sudden surges of mood and energy. This calming effect happens across multiple brain systems, which explains why lithium carbonate treats mania, prevents its relapse, and reduces suicide risks. Because it works inside neurons rather than directly at receptors, its effects develop slowly and require consistent dosing and blood monitoring. An important thing that you have to remember when monitoring lithium levels is timing. The blood sample should be taken 12 hours after the last dose. This timing is non-negotiable for accurate measurement and interpretation. So how frequent should we monitor blood lithium levels? Lithium levels must be checked weekly during initiation and dose changes. Then it should be checked every 3 months once the patient is stable. The patient should also have additional monitoring during illness, medication changes, or suspected toxicity. Lithium has a narrow therapeutic index. This means that there is only a small range between an effective dose and a toxic dose. And here are the levels that you have to remember. We are done with the blood lithium levels. Let us now cover therapeutic effects of lithium carbonate. Lithium's effectiveness is measured primarily by behavioral and functional improvement and not by lab values alone. In acute mania, the nurse should look for the following: less pressured speech. The speech of the patient will become slower, more organized, and less intrusive. Improved sleep patterns. The patient will be able to fall asleep and stay asleep more consistently. Tamed hyperactivity and agitation. The motor activity of the patient will decrease. The pacing, the restlessness, and overactivity will lessen. Halted impulsivity and risk-taking. The patient will display fewer reckless behaviors, and also they will have improved judgment. Improved attention and concentration. The patient will be able to focus longer and complete tasks. The patient will be under better emotional control. The patient's mood will become less labile and more stable. More organized behavior. The patient's thought processes and daily functioning will generally improve. A key learning sign that lithium is beginning to take effect is that the patient is able to sleep normally. This often happens before full mood stabilization occurs. In maintenance therapy, the patient will be stable. The patient will have smaller mood swings. There will be fewer episodes and reduced severity of highs and lows. The patient's treatment adherence will improve. The patient will be more consistent with medication and follow-up care. The patient's affect is better regulated. The patient's emotions are more controlled and appropriate to the situation. Better daily functioning. There will be a noticeable improvement in their ability to work, study, perform self-care, and maintain relationships. There will be less relapse over time. The patient will have longer periods of stability between episodes. Enhanced quality of life. The overall functioning and well-being of the patient will be improved. Importantly, lithium is one of the few medications shown to reduce suicidal behavior, which may be reflected in improved safety and reduced suicidal ideation. Now, we go to its side effects. Lithium side effects exist on a spectrum. Some are common and expected at therapeutic levels, while others signal toxicity or long-term organ effects. Nurses must be able to distinguish between manageable side effects and danger signs that require urgent action. The first one is leukocytosis, a benign increase in the patient's white blood cells. Take note that this is not an infection by itself. Increased thirst and urination. This polyuria and polydipsia is due to reduced renal concentrating ability. Tremor. Fine hand tremor is common and dose-related. This worsens to coarse hand tremor if the patient develops toxicity. Hypothyroidism. This is decreased thyroid hormone production. We, as nurses, should monitor the patient's thyroid-stimulating hormone regularly, and this is treated with levothyroxine. Itchy skin or pruritus. This may occur with or without rash. This can worsen psoriasis or eczema. Upper or lower extremity edema. This is mild, usually bilateral swelling due to altered sodium and water handling. Metallic taste. Patients report altered taste sensation, and this is usually benign. As I've mentioned, lithium has a very narrow therapeutic dose. As such, it is a high alert medication. It is a critical nursing knowledge for us to know the signs of lithium toxicity, which we can remember with the letter C. The first one is coarse tremors. The fine tremor before will become pronounced and uncontrollable if the patient develops toxicity. The patient's coordination will be poor. This is known as ataxia. The patient will have unsteady gait or difficulty in walking. Also, look out for confusion. The patient will be disorientated. The patient will display slurred speech and altered mental status. A common board exam item is that the patient will demonstrate continuous vomiting and diarrhea. This severe gastrointestinal upset indicates rising lithium levels. Also look out for convulsions. There will be seizures in severe toxicity. And lastly, comatose. There will be life-threatening CNS depression. Now let us talk about the nursing interventions. We can remember this with the mnemonic HALT. The first thing that you should do is to hold the next doses of lithium immediately. Next is alert or escalate it to the doctor urgently. And look for worsening symptoms. Continue monitoring the patient's vital signs, neurological status, and fluid intake and output. Lastly, test the patient's blood lithium level urgently. Now, what is the medical treatment for lithium toxicity? It is treated with IV fluids, electrolyte correction, and even hemodialysis in severe cases. And now we will discuss some additional vital information about lithium carbonate. Lithium is absorbed through the gastrointestinal tract and is excreted almost entirely by the kidneys. This has major nursing implications. Lithium is handled like sodium in the body. Changes in fluid or salt balance change lithium levels. Dehydration causes lithium levels to rise. And you have to remember that lithium is not metabolized by the liver. This means that the kidney is the single most important factor in lithium safety. Now let us talk about drug-to-drug interactions. Several common medications can increase lithium levels, such as NSAIDs, for example, your ibuprofen and naproxen. These drugs decrease lithium excretion. And also your ACE inhibitors, such as ramipril or captopril. These also decrease lithium excretion. And lastly, thiazide diuretics, such as your hydrochlorothiazide and indapamide. They increase lithium reabsorption. These three drug groups increases the risks of lithium toxicity. Now let us talk about contraindications and special populations. Lithium is used cautiously or avoided in pregnancy, especially in first trimester, renal impairment and cardiovascular diseases, patients who are dehydrated and severely ill. Risk to benefit assessment is essential. Now we have to remind our patients that lithium cares, which stand for consistent salt intake. Remind them to attend all blood tests, recognize early toxicity signs, ensure hydration, and to never stop lithium suddenly or abruptly. And that ends our lecture about lithium carbonate. Lithium carbonate is one of those medications where strong nursing knowledge truly matters. When you understand how it works, how it's monitored, and how toxicity presents, you move beyond memorization and you go into safe clinical reasoning. Thanks for watching LANS, lectures about nursing concepts and examinations. Keep approaching nursing with clarity and confidence. And I'll see you in the next lecture.